In a lot of the hospitals, they centralized a lot of the complex surgeries in one location. But what we realize is it's sometimes difficult for the patient to actually come up to New Haven or come up to Bridgeport Hospital. And we want to put forward a more patient-focused approach where we actually come down and meet the patient.
Having a multi-specialty group is exceptional both for the provider and the patients. They have one-stop shopping in their neighborhood where they can see all the specialists they need. Gastroenterology and colorectal surgery, as well as general surgery, bariatric surgery, all overlap extensively. So having us all in the same area, we can discuss complex patients and provide streamlined, great care for those patients.
In the Westport location, we have easy access for patients. There's one level where patients are parking and entering the facility. They're greeted by the reception area. That's where they get checked in. Then when they get called back by the medical assistant, there's a triage room that they get their vitals checked. They might ask them some questions there. As they move back into the office, there's 5 exam rooms and there's 1 procedure room. There is a room there for physicians for telemedicine visits. Large collaborative rooms as well, where there's multiple computers and doctors are able to sit and document after patient visits.
Patient will have access to a multidisciplinary team that provides medical and surgical weight loss, dietitians, exercise physiologists, and mental health providers.
Well, you really have an access point to all the colorectal surgery services that Yale New Haven Health provides by coming into the Westport location. So it really is a touch point for access to everything that our system offers patients in colorectal and digestive health care.
I'm a colorectal surgeon who specializes mostly in colorectal cancer and inflammatory bowel disease. So I do a lot of the reoperative colorectal cancer surgeries. We should be able to treat everything at this location, from the simplest stuff, things that we can do in an office location, to consultations for major intraoperative reconstructions. I use the bariatric surgeons for a lot of the abdominal wall reconstruction. So, for example, if we're thinking about doing a major surgery where we're reconstructing the bowel, it's also nice to meet the bariatric surgeon who may potentially do the hernia repair for us. And that is one of the big advantages of the center.
To be in a location where we are treating patients with our surgical colleagues who also have expertise in GI, it allows the patient to have a full evaluation in one location. The Westport community has a growing young population, and there are many, many patients there who need screening and preventative services and would benefit from being in the Yale New Haven Health System for all of their care.
When we work as a team and we communicate effectively and we work together in the same space, we always provide better outcomes for patients.